Hi, I'm Dr. Maya Evans. I'm a specialist in physical medicine and rehabilitation and an expert in brain injury. How can I help you?
Hi, my name is Taylor. My 5-year-old son was recently diagnosed with a concussion, and I'm just pretty worried about how to take care of him and how to make sure that he doesn't get worse.
That is completely understandable. Concussions can be scary, but they go away on their own, and the key to getting better is rest. So we really want to make sure that your son gets a good amount of rest and that we protect his brain while it's healing. I'll go over some specifics for you now.
Have your child avoid play that's too active or rough until your doctor says it's safe. Give the brain time to heal with both mental and physical rest. Keep your child calm and limit TV and screen time. Call your child's healthcare provider to tell them about the injury to your child's head and find out signs to watch for. Your child should be monitored for symptoms for at least 2 to 3 weeks. If possible, keep your child home with you for 48 hours or more before returning to school or daycare. Extra supervision after a concussion is very important. Do not use ibuprofen for the first 48 hours. Ibuprofen should never be used in babies under 6 months. You may use acetaminophen to help with pain if approved by your child's healthcare provider. Your child may be tired and need to sleep more, especially in the first few days. If your child can't be woken up, call 911 immediately. Keep the normal sleep nap schedule, and be sure to recognize that they might even need more sleep than usual. Make sure your child drinks enough water and eats healthy foods to encourage brain healing. Your child should play quietly for at least the first 24 hours with no active play.
Wow, that's kind of a long list to keep track of.
It really is, but you'll have this video so you can look back on it to remind yourself of all the things. It's really important that you call your doctor if there's any concerns or different behaviors. That way he or she can evaluate your son to make sure that everything's okay.
Gotcha, that makes sense. Thank you.
My pleasure. Of course, I also wanted to mention that there are things you can do to help prevent future concussions, and I'll go over those now.
A second concussion while the brain is healing can be very dangerous. Don't leave kids unsupervised and ensure they are playing in safe spaces. Don't leave babies unattended on changing tables, countertops. Similarly, avoid placing a baby car seat onto a changing table or countertop. Make sure they always have the correctly sized car seat. Always wear a helmet and other protective gear. Never leave children alone by the bath or pool area. Safeguard the home when it comes to outlets and window guards. Keep furniture away from windows that a child may be able to fall out of, and supervise them when climbing stairs.
Thank you so much, Dr. Evans. I feel like I know so much more about concussions, and I feel a lot better about how to make sure my son is safe.
My pleasure.